Okay, this is Dr. Beyer, Beyer Chiropractic Center. We're talking to Steve, who came in just shy of 2 weeks. Hasn't even been 2 weeks, and Steve, we're getting pretty good results. I think in large part with the decompression therapy. But if you could just share, symptoms you were experiencing, and for about how long, and kind of some of the treatments that you tried before coming here and so forth. So.
Okay, sure. Well, again, my name's Steve, and I live here in Tinley Park. About a week or so before Thanksgiving, I don't know what I did, but my back started bothering me. And by the time Thanksgiving came around, man, I couldn't do anything. I was sitting in a chair. The grandkids were there, friends, neighbors. I couldn't help anything. It was difficult for me to, even sit at the table and eat.
What were you feeling? What part of the back?
It was in the back here, and it was basically getting my shoulder and my arm. It was go all the way down my arm. I thought I had, like carpal tunnel. My hands were going numb. Mm-hmm. So the day after Thanksgiving, that Friday, I made an appointment, or called the doctor and told him what was going on.
Medical doctor,
right? My family doctor. He was actually out of town, and I saw a different doctor that was in the clinic that we use. And explained to her what was going on, and she prescribed Flexerol and gave me ibuprofen, and that was it. Said, well, you'll be okay. She tried to do an adjustment. So I got the pills, and I started taking the pills, and it really didn't do anything. So I thought, well, I've got to do something here. I'll go to a chiropractor. Mm-hmm. So I went to a chiropractor, and
different one, not
different
us.
one. No, not you. And I actually went there a dozen times. It was 12 sessions. I still have all the cards if you want to see them. And I wasn't getting anywhere. The guy would come and he'd have me sit in a chair, basically like I'm sitting now, and he'd want to, adjust my neck. And, sometimes, there'd be a little pop. Sometimes there wouldn't. Sometimes, he'd go, oh, boy, you're pretty stiff there today, huh? And,
but weren't really getting too much relief, right?
And I didn't get any relief.
Yeah.
And I thought, well, I went and I got a massage. I thought, well, maybe it's, just muscular, we can get this. I was getting scared. I went back to the doctor, and the doctor prescribed physical therapy. He gave me Vicodin, ibuprofen, and they, refilled the Flexerol. So I'm going for the therapy, and, I'm taking all these pills, and I'm still not getting any better.
So then you come to see us, yeah.
So I came here, and first time I sat down here, and laid down, and he popped my neck. Man, it was like fireworks went off. It was just like boom, and then popped it the other way, and boom, went right on down. And then we got on my back, and he hit it. It's like I could feel this whole thing all the way down through my arm. And it was like, this is different. Something is different here. And that was a Friday.
And then we did the decompression therapy.
Did the decompression and the TENS unit, or whatever that electric stimulation is with the heat. And
how'd you feel then?
I was kind of like taken back. I wasn't sure what exactly had just happened, but through the weekend, I actually felt pretty good. Better than I had felt, and I was like surprised. I didn't really know what exactly happened. And it came back in on Monday, and we talked, and he was asking how I felt. Doc. Steve, right? Yeah, Steve.
Yep.
Yeah, I'm sorry. Yeah. I told him that I was feeling better, and I could actually point to specific areas on my neck and back that, it's like now I can pinpoint this is where it hurts, and this is, I got some pain here, and we did, got my neck, and he's worked on my arm again and again. You could just feel all this stuff, and it's like when the shock was going down. It's like you could feel the muscles and stuff starting to loosen up, and I worked my back, and it's like I don't know what I had back there, knots or whatever. Everything started going away.
Yep.
And before the week was out, I actually felt good. I really and truly felt good, and I don't know what it is that he's doing different than the other chiropractor did. But I do know when he does my neck, he does my back. It's completely different.
Well, you're feeling better.
I'm
Proof's
feeling
in the,
better.
proof's in the pudding,
Yeah.
right?
You know,
Real
and,
good.
you know, I'm not going to give you the other guy's name. If you want to see the cards, I do have them. I'll be glad to give them to you.
No, that's
you know,
okay.
you can
No.
see it.
I'm just glad you're feeling better.
know,
That's good.
Yeah. So.
Well, you're going to continue to do well. I appreciate you giving this testimonial, Steve.
Oh, it's my pleasure. I appreciate what you've done.
Real good.
You know, so thank you very much.
You bet.